Hi, good evening, everybody. This is Dr. Abby, and I'm here to speak to everyone about diabetes. Over the past few weeks, we've been asking all of our patients to submit questions about what they had about diabetes, and a lot of the questions came back that they were asking whether or not this disease can be cured, whether or not their body can still repair, if they have permanent damage, what type of testing, what did the test mean, as well as what type of diets that they should be on or supplements that they should be on. So we're going to touch on a lot of those different topics, as well as I want to make sure that everyone knows that the diets that are out there for diabetes are not just for diabetes. It's also out there for any other inflammatory condition and pretty much the American lifestyle diet nowadays. So there's a lot of things that you can listen to in this podcast that's not just for diabetes. It's also just for healthy living and living a life that's optimal for you. So let's get started. First of all, I'd like to talk a little bit about what's going on here in the United States. According to the American Diabetes Association, 23.6 million Americans are actually suffering with diabetes, and 57 million have pre-diabetes. So that's a lot of people, and we're actually starting to see now that many of our children under the age of 12 have type 2 diabetes. And really, 10 years ago, that was unheard of. Back in the day, it was actually more that children had the autoimmune case, which is type 1 diabetes. But with now seeing the rise of type 2 diabetes, we really need to put on our alarm and say, okay, what are we doing wrong here? And what is the lifestyle like here? A lot of it is too many sugars, too many inflammatory foods that's giving us a lot of problems in our health. So many of you guys out there don't even know really what diabetes is. And we're going to especially talk about diabetes type 2 tonight. But first of all, let's talk about what the normal body's response to sugar should be. And in a normal body, a person should be able to consume sugar or consume carbohydrates. It goes into the body, becomes a starch, then it actually turns into glucose molecules. Once it's a glucose molecule, the body actually stimulates the pancreas to produce insulin, and insulin actually will bind to the glucose molecules in the bloodstream and take those glucose molecules to your cells to be used as energy. So it actually travels to the cell, and your insulin is actually your key to get into the cell. So it actually unlocks the cell, allows the glucose molecule to get into the cell, and that's how you actually are going to create ATP or energy for your cells so you're not overtired. A lot of times too, these glucose molecules are used as storage so that when you do need an abundance of energy, you actually have stored up glucose molecules in your cells. But the problem is that too, sometimes we have too much glucose molecules that are circulating. So talking about diabetes type 2, a lot of times is that there's a misfunction in the actual insulin receptors, so you actually start to burn out your insulin receptor sites. So you're eating those sugar molecules and you overdo it, and what happens is the body's still producing the insulin, but the insulin no longer can unlock the cell. And so you need many different insulins to be able to unlock the cell, and your body can't keep up. And so that's what happens when you have diabetes type 2. Another big problem is that when you actually have the diabetes type 2, then you will actually start to create molecules that are called the advanced glycolytic enzymes. And those glycolytic enzymes actually create an inflammatory response, which then damages the neurological and the cardiovascular areas of the body, which is why you start to see a lot of your neuropathies. You start to see people that are losing their eyesight, they're losing their limbs, they start to lose their heart function, and a lot of times they do die of heart attack in the end stages. So those are the things that you need to think about when you are given the diagnosis of diabetes, that it is a curable disease, and that if you don't, then a lot of times that you can have some severe damage into the system that could be very permanent. So what kind of testings are out there now for diabetes? Well, there's 3 main tests. One is a hemoglobin A1C, and this is done over a 3-month period of time. A normal reading for the hemoglobin A1C is going to be below 5.7, and a lot of doctors want it below 5.4. For someone that has prediabetes, it's 5.7 to 6.5, and for someone that has diabetes is above 6.5. So the second testing that we also look at is the fasting plasma glucose test. This is actually a test that you fast for 12 hours. Normally they tell you don't eat the night before, and then you take your blood glucose level the next morning. And the normals for that would be 100 milligrams per deciliter below. And most people want to see it below 90 milligrams per deciliter. So in prediabetes, it's 100 to 126, and for diabetes, it's above 126 milligrams per deciliter. Now, the last test that we're going to talk about is the oral glucose tolerance test, and this is done most often. This is where you can actually go out and buy a kit on your own. And you can test your glucose levels at home, and they should always be below 140 milligrams per deciliter. A lot of times too, you can actually buy a quick test, and you test it after your eating period, and within 2 hours it has to be below 100, so you want it between the 85 and 100, or if you take it right after you eat, even with food that's below the glycemic index type of foods, you still want your levels to be below 120. So even after eating a meal, your levels should be below 120. Not just due to the glucose levels, but you should also, when getting tested, also check for your homocysteine levels as well as your C-reactive protein levels. The homocysteine levels are normally elevated due to failing to consume enough B vitamins or a decrease in vitamin D3. Also, the C-reactive proteins will be elevated due to a high inflammatory state in the body. Having that high inflammatory state in the body can cause a lot of different things. So when your insulin levels actually go up, you have the increase in inflammation. You actually will have a decrease in the liver detoxing, an increase in blood pressure, an imbalance in your neurotransmitters within the brain. You have an increase in oxidative stress, which again, we know that oxidative stress will sooner or later cause cancer in the body. You have an increase in estrogen in males, and you have an increase in testosterone in females. And we also have an increase in cholesterol. And I left cholesterol as the last one because I want to touch on that one a little bit, because a lot of people have a misconception of what cholesterol really is. And in the body, so you have 9 or 10 different molecules that are like your cholesterol. And so when you go and get tested, they test for the very high LDLs, they test for the HDLs, and they test for a lot of different things. And so one big thing about cholesterol is actually a protective mechanism within the body. So when you have a high inflammatory state within the body actually sees that, and it actually pumps out cholesterol to be able to save the body of that high inflammatory state. So it's actually a protective mechanism. So a lot of times when you see someone that's taking a lot of medications for cholesterol or lowering your cholesterol, you're actually doing more damage to the body because no longer you're taking away the cholesterol, but you still have that inflammatory state. So you end up damaging the cells more because you don't have that cholesterol protective mechanism. So the myth behind the cholesterol is that cholesterol is actually good for the body. It's actually a signal to you saying that there's something wrong. We need to protect the body. We need to change the ways that we're eating so that we can get the inflammation out of the body so it doesn't damage the cells anymore. So what does the diet look like for someone that has diabetes, or just someone that wants to get healthy or has other conditions that are highly inflammatory, such as your ADD, ADHD, autism? All these kind of disorders are, this diet that you use for the diabetes actually works very well for that, as well as cancers. So there's a lot of studies about what we call in our office the advanced plan, or what a lot of other people call the ketogenic diet. So what exactly is the ketogenic diet? It's actually using your ketone bodies or your fat molecules as energy or fuel for the body. So in the body you can actually use two different molecules as energy. So you have your glucose or your sugar molecules, or you can burn ketone bodies, which is actually your fat molecules. So of course we all want to burn our fat, right? And so by doing that, what do we need to do? We need to eat more fat. We need to actually become fat adapted and be able to burn that fat as a primary energy source in the body. So, and I want to make sure that everyone understands that being in ketosis is different than being in ketoacidosis, which is the dangerous form that many of our diabetic patients get into. So becoming a sugar burner, you are actually depending on your insulin and your cortisol to be able to constantly pump out that sugar. And so you end up with hormonal dysregulation. A lot of times too, in diabetes especially, you end up with a poor protein or muscle wasting in the legs and in the arms. But what we really want is we want to have a keto-adapted diet, which it's very efficient at storing the protein and the glycogen, and that's basically stored carbohydrates. Our goal is to be actually at rest. We want to be burning and breaking down those ketones, because that's when you're actually going to start to break down your fat molecules and use those as energy. So let's talk a little bit about the macronutrients. So we have our proteins, we have our fats, and we have our carbohydrates. And so what it looks like on a ketogenic diet is that you want at least 60 to 80% of healthy fats in your diet. So that's going to be like your pastured butter. You're going to have your nut butters. You're going to have your nuts, such as macadamia nuts, your almonds, your pecans. Your macadamia nuts are probably one of your best, actually, because they do have such high fat in them. Other seeds are also great. So you have your chia seed, your hemp seed. A lot of times too, you can use a lot of the pasture-raised eggs, also have really good fats in them. Then there's the avocados, the coconut oil, the olive oil, your coconut milk, your almond milks. Those are all very good for you when you are on the ketogenic diets. So then you also have your proteins, which you're going to have about 10 to 25% per day. And of course, if you're working out, then of course you're looking more towards the 25% in protein. And so that's going to be more like your organ meats. You're going to have a lot of your grass-fed beef, your chicken, pasture-raised chicken, your pasture-raised eggs. All these are great, as well as a lot of your fish, because those are very anti-inflammatory. And of course, you want to stay away from some of your bigger fish, such as the tuna, because again, they hold a lot more toxins in them. So stay away from the tuna, the shark, swordfish. All these have higher levels of toxicity than some of your smaller fish. And then when we get to the carbohydrates, we only want about 10 to 15%, and most of these are going to come from your vegetables, mainly the non-starchy vegetables. So you want to eliminate a lot of your potatoes and your grains. You don't want any grains. Also, you're going to be looking more for the lemons, limes. You can do berries. You can do a green apple. A green apple is actually great, especially when you have those sugar cravings. They actually help to curb those sugar cravings because they are lower on the glycemic index. As well as you can also do a half of a grapefruit, and that's also going to, because it's bitter, it actually will start to make you not crave as many sugars. So how long does it take to actually get into ketosis and have your body keto adapted? So for the healthy individual, it should take within 2 to 3 days, you will actually enter into ketosis. And within a week, you actually become keto adapted. For someone that is diabetic and that has been struggling with diabetes for a while, it actually will take 2 to 3 weeks for the body to actually become into ketosis and to start to use those fatty acids as your fuel for the body. Now, once you have entered into ketosis and you have become keto adapted, then that's when you want to start also to cycle the ketogenic diet. So that means that maybe once every week you add in a sweet potato, or you add in a little bit of your brown rice or a little bit of your quinoa. And that way it actually starts to cycle your body, and your body will start to change, and you won't end up in that plateau stage that a lot of us get into. What this does is it actually loads glycogen in the liver and into the muscles, and it actually increases your metabolism. So it stores more glycogen so that you can notice a big difference in the effects of it all. The other positive effects of being on the ketogenic diet is actually that you're going to have a ton more energy. You're going to be able to think a lot better. Your brain function will increase so much just by being on this type of diet. Not just that, but you're not going to be hungry all throughout the day. And a lot of us believed in the eating 6 meals a day, which has actually been proven to be false now, is that it's actually better to do somewhat of an intermittent fasting throughout the day, in which you eat 1 or 2 meals and then you do a short amount of fasting. And what that actually does is it increases your human growth hormone, and you actually start to burn more fat as energy sources. Now we're just going to talk about some of my top 10 picks for people that have diabetes type 2 that they must have when going through the healing process. So number 1, you want coconut oil, because that's going to be your medium chain fatty acid that actually goes straight to the liver to be used directly as energy. So when you're using the coconut oil, what I would suggest is even taking a tablespoon of coconut oil in the morning as actually a supplement form, or throwing it in a smoothie, and that way you're getting those good fatty acids in the system, and so your body automatically knows how to start using those as energy sources. Coconut oil has also been proven to help with weight. It helps to boost the metabolism. It helps support immunity. It slows the skin aging. It aids in blood sugar regulation. It also aids in cholesterol regulation, provides stabilized energy. It effectively heals candida, so anyone with your yeast infections. It's effective in Alzheimer's disease. It heals eczema, psoriasis, rosacea, any acne, or any fungal infections. It's actually been proven to be an antibiotic and an antiviral. So coconut oil should definitely be in your cabinet. Then we're going to talk a little bit about ginger. Ginger, it actually helps a lot with any of your cravings. It's also been proven to be antibacterial and antiviral and antifungal and an antiparasitic. So it's actually going to help to decrease the inflammation in the body. It's a super antioxidant and a free radical destroyer. So it's also very good for digestion. It's very good for anyone that has cancer or diabetes, anyone with the inflammatory state. So again, what I do with the ginger is I'll either cook with it in a lot of actually I put it in my eggs, I'll put it in my soups, my bone broth. I use it for a lot of different things. I also use it when I make a ginger tea and add a little bit of coconut milk in it, and that way I have something to go to. Another big thing is your lemons. So you want lemons and limes in your diet because, again, this is going to increase your vitamin C levels. It's going to increase your live enzymes to help break things down, as well as it's going to increase your potassium. It helps the liver and the kidneys in detoxification. So again, you have to have a healthy liver in order for the body to have a healthy system and to decrease the inflammation in the body and to detox the body properly. Another big things is the avocados. Again, avocados are great. They have really good fats in them. Of course, we all here in Texas, we all love our guacamole. So you can make guacamole and you can, smear that on your chicken, and that way you have a really good meal for your lunch or your dinner time without the inflammatory foods in there. So the fifth thing that I'm going to talk about is the Himalayan pink salt. And a lot of us believe that the salt actually raises the blood pressure and causes a lot of issues in the body. Well, the good thing about the Himalayan pink salt is it actually doesn't. It actually will balance the blood pressure, and it helps a lot with reducing any edema in the body. It helps with swelling. It helps with cellulite in the body. So the Himalayan pink salt is amazing, and it also just adds some great flavor to any of your foods. So next on the list is your apple cider vinegar. And this is great because it's fermented and it actually will increase the enzyme count in the body. It's great. It's a great organic acid that's going to help the body in the digestion. It's going to stabilize the blood sugar. It's going to reduce inflammation, and it improves any of your skin tone. With the apple cider vinegar, I actually use this as one of my salad dressings. So I'll actually put maybe a tablespoon over my salad along with like an olive oil, and that way you have basically your oil and vinegar. Another thing that I do with this is that I will actually put 2 tablespoons in the morning before I eat anything in the morning. 30 minutes before, I'll actually put 2 tablespoons in my water and drink it down so that I actually begin to create good enzymes for when I do eat breakfast. And what those good enzymes are going to do is they're going to actually help you to break down food. So it's better for digestion. Next on the list is right in season right now because we are just now finishing up with Halloween, and so we have a lot of our sprouted pumpkin seeds. So that's going to be great. I use these again for snacks throughout the day. They're very high in B vitamins, magnesium, and your zinc. So that they're full of just powerful anti-inflammatory nutrients so that the body can repair itself. Not just that, but they are one of the most alkaline forming seed. They're loaded with iron and copper, and they're great if you need any sources of vitamins E, G, and K, and which we can actually get into in a different talk. But one of the best things is that it's one of the biggest fighters of osteoporosis as well. So then number 9 on the list would be the spice, the turmeric, which a lot of us have heard, especially lately in the news, about how it's helped a lot of people that have cancer and fighting cancer naturally, but mainly because it's a powerful antioxidant. It helps to reduce inflammation in the body. It helps to improve the detoxification in the body. So a lot of times with this one, it's best absorbed if you use it with a fat. So if you use some type of fatty meat, or what I do with it is I actually mix it in with my eggs in the morning. If I have a breakfast, I put turmeric as well as curry and black pepper, and that actually increases the absorption rate of the turmeric, and it's best used in the body. And so another thing with the turmeric is great if you have any joint pain due to inflammation. So a lot of times when you have knee pain or elbow pain due to overuse, then that's also a great spice to increase in your diet. So the last but not least is going to be your bone broth. And I've talked a lot about the bone broth. Something great about the bone broth is that it has a lot of your collagen still in it. It has a lot of your nutrients that are in the fats that you can use for basically a supplement form. So what you actually do is you actually take for instance like a whole chicken, and you are going to put it in a crock pot and you melt it down with the bones still inside with water, and you can do celery, you can use yellow onions, garlic, parsley, ginger, sea salt, and apple cider vinegar, which incorporates all of what we just talked about, and put it all in your bone broth, and you're going to use this as a supplement. And what this really does is it helps to repair your gut lining. It also helps with collagen support, so it's a very good anti-ager, as well as it's an anti-inflammatory for the body. Another big one that I forgot to mention was the cinnamon. And cinnamon is actually great for lowering that craving for any sweets. It actually decreases the amount of want for insulin. So cinnamon is actually a great one to also incorporate. Putting it in like a full fat coconut milk and just stirring it up and having that as a drink during the day is actually going to help a lot with the sugar cravings that a lot of the diabetic patients have. Another thing that if you do need sugar, if you do have that sweet tooth, you can use the stevia, which making sure to get the pure leaf stevia is the best, because a lot of times now they're actually selling many of our stevia with other products, and I've even seen products on the shelf that don't even have stevia in them, and they have stevia all over the box, but you look at the ingredients and there's not even stevia leaf in them. So be really careful with the stevia that you're picking out for that purpose. Another thing too is getting the cacao, and which is basically chocolate. And so those of you that have a sweet tooth, you can actually use that, as well as putting it in with, take like a raw butter and using it with raw butter and throwing in some full fat coconut milk. And you actually have and if you roll it up, it actually becomes like a little chocolate ball with stevia, and it actually tastes pretty good. It's a really good alternative if you do like the candy bars and that sort of thing. Then that actually will help to kind of give you that taste of sweetness that you really need. Or another option is if you make a protein shake. So you can do the chocolate protein that we have and add, the stevia. You can add avocado to that. You can do the coconut milk, add chia seed, flax seed, and a few berries. And you also have like a sweet treat, just like if you were to drink, a smoothie from any other place that normally is chock full of tons of sugar. So now let's get on to the topic of exercise, because one big thing with diabetes is that you don't know how to properly exercise. And so a lot of times they tell you to go and walk for a few hours or something, but really the goal is to get your oxygen levels up, and in order to start to repair the body, and in order to decrease those cortisol levels, because what cortisol is it's actually a stress mechanism that the body sends out, so that you're in a stress state and the body actually pumps out cortisol into the body, and that cortisol will send sugar molecules out into the bloodstream in order for your cells to have enough energy to, basically, they're in that fight or flight mode or run from a bear mode. And so that's what a lot of us Americans are in because we work so much. We're in constant stress mode. So that's really what we got to learn, how to use those stress times to be able to decrease those stress times in order to heal diabetes or any other health condition. So one way of doing that is by increasing your burst training or surge training, which again is fast repetitions. It's a high intensity interval training type of program in which basically you get your heart rate up for 20 to 30 seconds, then you want to drop it, then increase it, then drop it. And you do this on a series of about 4 sets. And this is about a 12-minute program per every other day. And what's so great about doing this type of surge training is that it actually will enhance the human growth hormone. It increases your testosterone levels, which again, that's going to help you to burn fat for a longer period of time. So you're actually, by doing a 12-minute program, you're actually burning 24 to 36 hours after you've worked out. So you don't even have to work out every day. You can work out every other day and still get the benefits of working out. And so that's also going to help to repair and heal the pancreas and help to heal the insulin receptors that in diabetic patients that's actually damaged in. So now that we have talked about the diet, the exercise, what are the best supplements to take, what are the best things to do during diabetes, my most important one that I always talk about is, of course, getting your adjustments, getting your chiropractic care, because what that does is it allows that brain to communicate down that spinal cord and out to the nerves, especially to the nerves going to the pancreas, and utilize everything that the body is putting inside of it. So even if you have what we call a subluxation or a pinching on that nerve where that brain can't communicate any longer down that spinal cord and out to that nerve to the pancreas, then you're not going to be able to utilize the nutrients that you're even putting into it. So going out and getting your spine checked, making sure that those nerves are free flowing is also key in healing diabetes and getting over that type of disease. One final question that I did get from the office was that the person was asking, why is it easier to stop a salt craving over a sugar craving? And my response to that is that sugar in the body is actually, it actually activates the brain in the same way that cocaine actually activates the brain. So it actually uses about the same pathways. And so sugar is a very, very addictive substance. It's more addictive than most drugs out there. And so that's one of the biggest reasons that it is so hard to get away from, especially today's age, because it's in everything. It's in all your condiments. It's in your ketchup, it's in pasta sauce, it's hidden in everything. So if you're not careful, you're consuming, the American diet actually consumed over 160 pounds of sugar per year. So that's a lot of sugar that we're consuming. And so another thing with the salt cravings is a lot of times the salt cravings is due to most likely you're dehydrated, you don't have enough water intake. The body actually needs the electrolytes in the body to restore balance. So normally when you're craving those salty things, it's actually a deficiency, whereas sugar is actually a toxicity as well as an addiction to the body. So it's two totally different mechanisms in the body. But But I hope that answers all your questions. And if you do have any more questions, you can go ahead and ask them in the down below box, and that way we can actually get back to you. But thank you guys all for listening in, and I hope you learned a lot from this talk. I do these mainly for education purposes so that you can understand better how to take care of your body, because really that's my goal, is to help people to be their own doctor and to really understand what their body's doing and understand how to live an optimal life and feel better. So thank you guys all, and have a great night.